1 in 5, or 20%, that's how many police calls involve a mental health or substance abuse crisis, according to estimates from the American Psychological Association. That agency says the need is growing.
It surveyed 2,400 senior law enforcement leaders all across the country. 2/3 said the amount of time their department spends on mental illness calls increased during their careers. And more than half said that increased time is because they do not have the ability to refer people to the treatment they need. Welcome to News Center Maine at 5:30, everybody. I'm Zach Blanchard.
And I'm Chris Costa. Thanks for joining us. Saco is the latest city in Maine to add a new type of mental health worker to its police department. But this person is not an officer. She's a community engagement specialist. She meets with people in crisis and gets them the help that they need. Now, there's a lot of new interest in this because of the attention surrounding the murder of George Floyd. She's been with the department for about a month. The chief tells us she's already making a difference.
Most people with mental illness are not dangerous.
That's where Shannon Bentley comes in.
And they said that there was an incident last night with you coming in.
Oh,
yeah. Yeah.
She's a community engagement specialist.
Backpacks and mittens and hats.
She works for Spurwink and contracts with Saco Police
Anything, really.
to respond to people who need help, not jail.
So a lot of it is co-responding with the police to mental health calls or substance use calls or really anything. There is so much more needed in the mental health world.
I don't know of a profession out there that's been asked to add more things to the playbook than law enforcement has in the last 30 years. We're asking a lot, and I think obviously what police officers across the country will tell you is it's so much that we need help. We need help.
Yeah, so these are like all the reports from overnight.
Shannon also helps follow up with people that officers interact with overnight. She's worked in crisis response in Kennebec, Somerset, and Cumberland counties. She started in Saco at the beginning of March.
And she's been busy every day. Every day.
In 2021, Saco police responded to 233 mental health related calls. The chief says those numbers do not include cases where someone with mental health struggles committed a crime, like assault or theft.
So the reality is 233 is underreporting, right? We're probably up towards 400 when you factor everything in. Well, that's a clue, right? We need to do something.
I don't think any family member wants their, son or daughter or whoever to be charged with a crime because of mental illness.
The reality is the criminal justice system is not where these folks belong.
I think every town should have one. I mean, we are answering that call.
So Saco is not the only city that has people working in this role. Biddeford has 2 of them. Scarborough, York, Old Orchard also have these community engagement specialists. Portland Police has its own behavioral health unit, and they are hiring for an alternative response liaison.